So, thank you, Robert, to join us today in this podcast. So, let me introduce you a little bit. So, you're a clinical psychologist and a professor, and one of the world's leading voices in trauma therapy. And your work has deeply shaped the way we think about healing, vulnerability, and the therapeutic relationship today. And in your book, Trauma and the Struggle to Open Up, in English, you explore with great sensitivity how trauma impacts not only ourselves, but also their capacity to trust, to connect, and to feel safe in human relationships. So today, I would like to explore with you the challenges that we can live as a therapist, of course, and into when trauma survivors are navigating together in this relationship from avoidance to safety to identity reconstruction, which is quite very difficult. So, I would like to start with in a therapy, it can be very difficult for trauma survivors to express themselves. And so, in your experience, how can a therapist know when the relationship is strong enough to go deeper into some details without overwhelming the client or risking to re traumatize them?
Mhm, mhm. So in our the issue of re-traumatization as a result of talking about your trauma history, that was something that became a really big topic in the 1990s because of the whole false memory debates. There was a period in which therapists were losing their licenses, especially in the US, because of lawsuits related to this idea of um, uh, accusations that therapists were suggesting that trauma happened that really didn't happen. And so therapists became very, very uncomfortable with the idea of talking about the trauma. Through the 1990s, it became something that was a great anxiety among trauma therapists. And in fact, there were things written about this idea that if you talk about the trauma too much with clients, that you will re-traumatize them. And so there had to be some real research to look at whether this, in fact, is true. Does it re-traumatize clients to talk about their trauma? And a few studies were done, including some of my research that was done through 2005 to 2015, a detailed study of children in trauma therapy. But I'm not the only one who studied this. Anthony Manarino, Esther Deblinger, these are all Americans. So I'm a Canadian. They were American researchers studying this in great detail among children. And then other researchers, especially at the American VA hospital, Veterans Administration's hospital, who looked at adults, especially war veterans, and the whole issue of re traumatization. And it turns out that re traumatization is more of a myth than anything else. It doesn't really re traumatize clients to talk about their trauma. It does stress them. It does definitely stress them, but it doesn't really re traumatize them. And our research on children, and I've also studied adults as well, same thing, but at that time, the earlier research that I did was on children and later on adults. Same results. It doesn't re traumatize as long as there's safety in the relationship. So that's the key issue. Is there safety in the therapeutic relationship? And it turns out that re-traumatization is very rare. It doesn't it stresses people, as I say. The issue is the relationship ready for the person? Is the relationship safe for the person to be able to talk about their trauma? So what does it mean to have a safe relationship? Well, there are a couple of things, but most centrally, does the client feel that they can trust the therapist? Does the client feel that the therapist validates them? Does the client feel that the therapist listens to them? Does the client feel anxious when they talk about personal matters, or does the client feel that they can slowly ease into personal matters? Those are the critical issues. And if the client does feel this sense of basic trust, the client feels that the therapist will listen, will validate their experiences without, will support them, then talking about the trauma turns out to be quite a healing process. And the theorist who really talked about this in great detail was Judith Herman in her classic book, Trauma and Recovery, where she really lays out safety first. That safety is the most important thing, security in the relationship, in the therapeutic relationship, and then the client can begin the process of talking about the trauma. But that's really, really important. Um, and it varies from one client to the next. So here's where it gets really tricky is that you might say, oh, well, of course, safety. I'm a therapist. I know the client needs to trust me. The client needs to feel safe. That's not a surprise to me. What does that actually look like? Well, that's tricky and it varies from one client to the next. And sometimes we don't always know right at the beginning. Um, but the classic indicators of safety are: does the client, show signs of being able to trust the person? When the therapist asks questions, does the client indicate signs of being receptive to their validation? Does the client show signs of receptivity to empathy? These are the signs that there's a sense of safety, there's a collaborativeness. Those are the things that I tend to look for, and sometimes I get it wrong, but generally, safety is the most key element.
Because there is a fine line to not get into too much details, right? And to not ask the tricky questions when we're dealing with such patients, to not be too much curious, to not ask too much personal questions. So there's a tricky line for the therapist as well. Yes.
Yes, I just would frame it a little bit differently. I would say curiosity absolutely is always okay. Um, what I what I would say in the beginning, so if we're talking about a short-term therapy where you only have 7 sessions to work with the person, I don't tend to ask people about their trauma history in detail at that time. If it's a longer term therapy where I have a few months to work with the person, then definitely over the course of the first few months of our work, I build the relationship with them, and later we get into details. If the client comes in, let's say, in the first 2 sessions and begins telling me extreme details about their trauma story, I will slow the process down with them. And I talk about in the book Trauma and the Struggle to Open Up, I really talk in detail a methodology for being able to slow the process down. So the balance is you don't want the person to feel that you're afraid of their trauma story, that you don't want to communicate to them this trauma that you have is bigger than the both of us, that I can't deal with your trauma history. I'm afraid of hearing about the details. You don't want to communicate that. On the other hand, you don't want to communicate the idea that that their trauma is, that you're interested in hearing every little detail about their trauma story right at the beginning. So balancing those two things is really important. You don't want to communicate this idea of I'm afraid to hear about your story, but you don't want to communicate this kind of voyeuristic desire to hear every little detail either, because then the person might feel that you're intruding on their boundaries. So how do you balance that? So in the book, what I talk about is the idea that if somebody comes in and is you have a sense that they're oversharing in the first session or two. So the person tells you a story and you don't really know about their defenses. You don't really know about their ability to keep themselves safe. You really don't know how they cope with everyday um, uh, feelings of emotional. How do they emotionally regulate when they're in distress? You don't have a good sense of them, and they come in and they just want to tell you every single thing that happened. I do slow them down. So I don't shut them down, but I do slow them down. And what I express to them very often early on is I call this honor the telling. So the person, um, I have an example in the book of a pilot who had lost some of his buddies in the war in Afghanistan, a Canadian pilot, and he started telling me in the very first session about sexual abuse that happened with his um, babysitter when he was a kid. I didn't know this guy. I knew he was a pilot. I knew that he was a military guy. I didn't know if how he would react the next day. Would he feel humiliated? Would he feel ashamed? I had no idea. And I was worried that if he spilled too much, if he overshared, that he might feel humiliated and ashamed and not come back. So the way I slowed him down was what I call the first technique is called honor the telling. Instead of asking questions about this sexual abuse that happened with his babysitter, what I did was I asked him questions about the process of sharing the story with me. So I said to him, let's call him Joe. Joe, you just told me a little bit about your babysitter. So this thing that happened between you and him. Tell me, is this the first time you've told this story before? So instead of saying to him, oh, you just told me about this oral sex that happened with this babysitter, tell me about the details that happened, rather than any of that, rather than getting into any details about the trauma event itself. What I did was ask him about the process of sharing the story with me. And I simply said to him, tell me, is this the first time you've shared this story with anyone? And he said something like, if I remember correctly, he said something like, well, no, I mean, I did tell my first girlfriend, when I was a teenager, but no, I've never actually told my wife, actually, I've never told anybody about this before. And I said to him, okay, so you've never told anybody about this before. Tell me, am I to understand then that this is really a personal, really a secret about yourself, a personal story about you, a secret? And he said, well, yeah, I guess so. I said, okay, so this is a really important aspect of your life, something that we're going to want to really think about as we work together in therapy. So the first piece is honor the telling, letting him know that this is an important story. The second piece is flagging it as a topic that we'll talk about down the road, and then make sure later you revisit the topic, you come back to it. And so, very often, what I find with trauma survivors is they might share a story, but then they'll never come back to it. And if the therapist says, oh, they'll come back to it when they're ready, they never do. The client never does. And so, the next few sessions where there's an opportunity, I might say to Joe, Joe, I notice it's been a couple months that we've worked together. I remember back in our first few sessions, you talked with me about your babysitter and how exposing and how upsetting that was. And now you're talking to me about this experience with your boss and how you feel exposed and humiliated. Tell me, was the feeling now similar or different from that earlier story? So, in other words, I'll bring the previous story back into the room. Why? Because if I don't, we might spend months and months in therapy never coming back to it. And we'll communicate the idea again, this trauma is bigger than the both of us. I'm afraid of revisiting it.
Mhm.
And so, this, again, I talk about this in detail in the book, but this three-step technique of honor the telling, then flag it as a topic that we'll talk about, the two of us together in our work together, and then revisit it when there's an opportunity. Those are the three steps. That really helps slow the process down of client disclosures of um, uh, personal traumatic material. It's a process that I use early on in the work to really slow things down because I find that clients have trouble balancing between, you know, I'm afraid to talk about this, but I've got this huge burden that I have to talk about, and I don't know how to balance these two parts of me.
So you're
So
building a rhythm even for the client. Yes. Yes.
exactly. Building a rhythm, a slow process by which they can share so that they don't feel like you're shutting them down, but you also aren't engaging in a kind of voyeuristic behavior where you're trying to hear every little detail before there's any relationship, any trust that's been built. And so
Mm.
finding that balance is really helpful in facilitating the process of opening up in a paced and stepwise manner.
Yes. And on the contrary, what happened when the client has this avoidance? So is not able to share, not able to find the right word. How do you protect the session so both of you can explore the issue? But you know how it's a tricky path as well. The avoid.
Yes, absolutely. So the first example I gave was an example of a client oversharing. What about the client, as you rightly point out, who undershares,
Mm.
who will engage in all kinds of avoidance behaviors? And that is very, very challenging. I did talk about this a lot in my first book, Trauma and the Avoidant Client. But even in Trauma and the Struggle to Open Up, in chapter 2, I talk about a case. This is the case of Nicholas,
Yes.
and he was a very interesting fellow, but he was a very interesting case of avoidance because sometimes when we think of avoidance as therapists, we equate it with narcissism. Those clients who don't want to talk, who dismiss emotional material, who are sort of um, better than that, or they come across as better than messy emotions. Um, but that's not always the case for clients who are avoidant. There are clients who are avoidant in more subtle ways. And the case of Nicholas is an interesting example because Nicholas is a very likable fellow. He doesn't come across as narcissistic at all,
Mhm.
but he is avoidant of attachment. So, what does that mean? He avoids vulnerable feelings and he steps aside from feelings that will create any kind of dysregulation or attachment anxiety. He sort of sets them aside. And his way of doing it was a very interesting case because he would use it by being a jokester. He would joke around. He would dismiss things in a more subtle way. Oh, he would turn the page in talking about something. He would skirt around a topic. He would avoid in more subtle ways by minimizing, but using humor, using positive, toxic positivity. Oh, I try to be positive about things, that sort of thing. And those kind of cases are sometimes harder to see because these individuals are very likable. They can be, in fact, they can be very, people will connect to them because they're fun, they're interesting, they're engaging, they can be extroverted. Um, and yes, of course, there are other kinds of clients who are avoidant, who are truly dismissing of feelings in a very negative kind of way. They will dismiss emotions and make people feel silly or stupid, calling people hysterical. This, oh, she's just being hysterical. She's just overreacting to everything, using kind of very dismissive language. And of course, those individuals may even come across as narcissistic. So there are different kinds of individuals who are avoidant. And sometimes it can be challenging for therapists to spot some of these individuals, especially when those individuals, as I say, are actually likable people. So it can be challenging in therapy. Uh, and in trauma and the avoidant client, I do talk about a bunch of different techniques. But the most important thing is to notice when clients are using dismissing strategies. And so, what are some of the dismissing or avoidance strategies? Well, intellectualization is absolutely a defense that's used. Rationalization, of course. And we see this with individuals who use cognition instead of affect, who will really engage in intellectualized discussion. But very often we also see talking around a topic, turning the page, sweeping something under the rug, idealization. Oh, my father was a wonderful man. He was strong, and he was a real, person you could admire, and kind of using kind of glowing language to
Mhm.
glorify somebody, as at the cost of not noticing or not conveying any of the vulnerable feelings. And so very often what we see as they tell their stories is that things don't add up. And with avoidant defenses, what you have are, in the language of the American psychologist Mary Bain, uh, violations of quality. In other words, their stories sound dishonest. So, on one hand, they may tell a story of the father who was this strong immigrant who came from Italy with $10 in his pocket and built a construction business, and, admiration, 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 glowing stories. And then in a later session or at some other point, they talk about how dad had this depression and would often cry for weeks on end. And then you would ask the person, well, how was that for you? Oh, it was fine. It only lasted a few weeks. Generally, he was okay. And things don't add up. In other words, there's a sense that the narrative, the story, is kind of incoherent. It doesn't fit together. The individual doesn't have a sense of the stories not fitting together, and they will use all kinds of defensive maneuvers in order to minimize the impact of the pieces of the story that seem vulnerable. And so the therapist has to pay attention to these violations of narrative coherence and notice them initially. Um, and so first of all, it's noticing. Um, Noticing also what are called trauma fragments, because
Mhm.
trauma fragments can be easy to miss, especially in an individual who is likable, an individual who has stories of overcoming adversity. Yes, we had it difficult, but we worked hard as a family. It would be very easy for the therapist in their countertransference to admire this person. Oh, look at this person. He suffered, but he overcame his suffering. Wow, what a strong person. The countertransference might get activated. Um, and the therapist might miss what are called trauma fragments. And so, what are trauma fragments? They're elements of the story that are non dominant. So, you might have a story of adversity and the family doing this and the family doing that, but there are little bits of the story that are dropped along the way that sound like they were emotionally probably painful, or they were vulnerable places, or perhaps this strong father who always was there for them in this wonderful way actually sometimes had difficulty, or perhaps there are stories of domestic violence that might be minimized, or stories of physical abuse that might be minimized. Like a story, yeah, that was that time that my dad my dad lost it and he really kind of went nuts. But then, everything was okay. And you might kind of bring them. You mentioned a moment ago that your father went nuts. Can you? Oh, yeah. I mean, every once in a while he would, hit us with an electrical cord. But, this was the 1990s. Everybody did that. Like, I mean, it's not like today when parents are helicopter parents and they're just trying to like help their kids all the time and kind of be there in their school, into their business and knowing every single thing. This was the 1990s. Parents, they sometimes spank their kids. No big deal. Anyway, I was talking about this other thing. And so you sort of see the person kind of skipping over, minimizing the impact, kind of dissociating, segregating material that's vulnerable, material that's what I would call a trauma fragment, a part of a story that's not really fleshed out, but kind of dropped along the way as they tell you these other stories. You want to pay attention to trauma fragments and notice them and be curious about them and bring the client back to that at a time when it makes sense to do so. And so that's really something that's very important. One thing that I would point out as a general principle of therapy when working with avoidant clients is that it's very easy to miss the ambivalence. So, clients who come across or present themselves as avoidant of attachment, as avoidant of vulnerable emotions, will lead with a strong kind of mind, a strong minded attitude. And what you'll miss very often is the ambivalence. And it's really important to notice the ambivalence. So, what do I mean by ambivalence? What I mean is the person is there in therapy for a reason. If everything was so perfect, they wouldn't be paying you whatever they're paying you to see you. They wouldn't be taking time out of their day. They wouldn't be taking time out of their work week to come see you and to talk about their problems. And John Bowlby, the attachment theorist, talked about avoidant attachment, and he said that with people who are avoidant, notice that unconsciously there is a yearning to be understood. So notice that, and that yearning to be understood is ambivalently held. So they lead with a strong intellectualized kind of presence or a positive psychology presence, but what is in the background, what is under the surface, is vulnerability, is a yearning to be understood, a yearning to actually be validated. And so you really need to notice the non dominant narratives. Notice those little trauma fragments that they drop along the way. Be curious about them, flesh them out, and give space for them to breathe in the therapy. And that will begin to open things up for clients who are avoidant. Now, having said that, and I've been talking for a while now, having said that, what I'll say is that when you do, with a client who has avoidant attachment, when you do show empathy to them, when you do validate, initially that is hard for them. And they may reject the the validation. They may reject the empathy because it makes them feel vulnerable.
Mhm.
And so that might be difficult. At first, you might say, oh, that sounds like that was really difficult for you when your dad hit you with an electrical cord. And they might say, well, no, I mean, I wouldn't say so. I mean, look, like I said, this was the 90s, and parents, like all my friends, we all laugh about this, that our parents like beat us when we were kids. Again, it's not like today, right? I mean, it's just not. They might say that. So they might do a lot of work, psychological work, to distance themselves from the emotion. That's okay. Initially, they might do that. Um, and you might pay attention to that. Don't give up. Don't all of a sudden go, oh, this client really doesn't need empathy. No, he still does. Stay with it. I'm in that particular moment in the session. Yes, of course, the client shows a defense. Pay attention. They're not ready for it yet. But it doesn't mean that later on or in another session or as you work with a person that they don't want to be empathized with. They do. Like I said, underneath that defensive core or that defensive, sorry, underneath that defensive shell is a core that is yearning to be understood. And so give space, come back to moments or opportunities to be able to empathize with the person. And they will eventually accept the empathy. Again, at the beginning, they'll push it away, but they will eventually accept it and they need it. And it'll be uncomfortable for them, and then you can work with them around what's this like to hear me. I mentioned to you that I was really feeling, kind of sad for you that this happened, and you seem to kind of react, Nicholas. What was that like for you? And be
Mhm.
curious about how they react to your empathy, because it's going to be weird for them. They're not used to this.
Do
So
you think
it's a slow process.
Mhm. Do you think it's harder for you, for example, to work with avoidant clients than to clients that have that urge to heal, to say everything, to give you every details? Do you think it's harder or it doesn't change?
It's harder.
It's harder.
It's in a It is. It is. It's more work.
It is.
It's this, you're sitting with them and they they push back.
Exactly.
What was that like for you when your dad did that? It's okay. Um, and so then they're sort of like it's like you play tennis with them, you and then they just send it right back. Yep. And so now almost as if they're saying to you, okay, ask me a different question.
Mhm. Mhm.
But what I do very often is I encourage them to stay with it. And I might even use a little bit of silence with them. It was okay. Okay. Tell me more about that. How was it okay? Well, like it was fine. I mean, like I said, I mean, yeah, he beat us. Like, no biggie. No big deal. No big deal. Okay. Tell me more. And I might be silent for a moment. Now this will create anxiety.
Oh, yes.
How much anxiety? How much anxiety? I will say that is a tricky question. As much as the client will bear, as much as the relationship will tolerate. So early on in the first two sessions, not too much. I'll play with it. I'll see what can they handle if I just sort of say, if I ask them to stay with a difficult feeling. I might say, I might even say to them, what's it like for me to ask you this? And look, I notice you were very talkative a moment ago, Nicholas. And now when I asked you what it felt like when your dad hit you, you gave me a very brief answer. What was that like for you when I was very quiet, and I noticed, and you were very quiet too. Oh, well, I was just looking around. I didn't know what to say. Okay. Does that happen a lot to you, that you don't know what to say when people ask you a question about what you're feeling? Does that happen a lot? And then Nicholas might say, oh, that's so weird that you're asking me that. My girlfriend says the same thing. She says to me, when I ask you about what you're feeling, you have nothing to say to me. Okay, that's interesting. So you're noticing that the way I'm responding to you is similar to your girlfriend. Yeah, well, she says that's why I need to be in therapy. Okay. Do you think that's why you need to be in therapy? I don't know. I don't really do emotions. My coworkers say the same thing, but I don't know. Is it a big deal? I don't know. Well,
Mm.
I don't know either, Nicholas. I'm not sure. Maybe that's something we'll try to figure out together. I don't know. That might be something we might work on. I'm not sure. So I'll just sort of initially play with it a little bit and see where we go. In later sessions, I might push a little more as we have, more built up of a relationship, right?
Yes.
As we've built up a relationship.
But it's all about, when I hear you, for the therapist to master the silence, because sometimes we are rushing into, or maybe we feel so vulnerable, or maybe we have too much empathy, and we do not master the silence. We do not allow ourselves to just slow down the process, right? Because we are in a urge to finish the session so we can build something from that, right? So I'm
Yeah, absolutely. And I find that
Mhm.
uh, with especially with starting out therapists, I really work with them to say fewer words of empathy. So,
Mm,
I mean, I'm primarily a psychodynamic therapist, and that's what I was trained on. So I do feel comfortable with silence, and
mm,
I do feel comfortable with seeing where that silence goes with clients. And but even when I'm empathic with people, I tend to use fewer words. So, you know, again, using the example of Nicholas, who just mentioned about his something or other, let's say his girlfriend, and how maybe Nicholas had a difficult sexual experience, and I might just say, he says, I just feel so embarrassed that we tried to have sex and I couldn't. I kind of got anxious, and I might just say to him, anxious? Okay, what was that like for you? I might just sort of, or I might just say, okay, and that was hard. It was difficult for you, and it's something like that. I might say something that just is slow, empathic, but not a lot of words. I don't tend to, wow, that must have been so difficult. You must have been so upset. I don't tend to use a ton of words with clients, as opposed to here when I'm talking a lot. But with my
as you
clients, I
should
tend
do.
to. But with my clients, I tend to be a little bit, um, I tend to let them struggle a little bit with silence to see where it goes, to let them. I mean, it can be hard. It can be challenging for them.
Exactly. And how do you sometimes people are thinking, okay, maybe I have to forgive that person so I can heal. So how do you deal with forgiveness as well for the survivors, should I say?
Yeah, yeah. So in trauma and the struggle to open up, I have a chapter on the topic of forgiveness, and I tend to view forgiveness as something we um, that can happen in trauma therapy, but that doesn't have to happen in trauma therapy. I tend to view forgiveness as something that, if it's going to happen, it's going to happen quite a bit late in the process. I definitely don't push it early on. I find that a lot of clients come in who have trauma histories telling me, it's been a year since, my husband and I broke up, and let's say it's a story of domestic violence. My friends are all telling me, you've got to move on already, Kelly. It's been a whole year. And I will say to them, let's slow down. Most of the time that people have been through a traumatic event, it can actually take a few years. And especially if it was a breakup, you know, friends very often want you to move on because they feel frustrated with you talking about your pain over and over again. They're not therapists, they're not trained. It's difficult for people to hear your suffering over and over again, and that's understandable. Again, they're not therapists. But for you, as somebody who's been through a traumatic event, I can share with you that sometimes it can be a few years for people to be able to recover from a traumatic event. And so let's not rush the process. And that could be hard for many people because they could feel like, well, hey, I I'm sick and tired of feeling this way. And I can empathize with them. Well, of course you're sick and tired. But grieving and the process of mourning a loss, that can't be rushed. People grieve at different rates, people grieve in their own way. The alternative to forgiveness is grieving.
Mm.
Someone who went through a domestic violence situation, physically abused, sexually abused, they're now single parenting, and let's say they've separated from their partner and it's been, let's say, 5 years. I don't know whether they're going to eventually forgive this person for what he did. Maybe, but they don't have to. They don't have to forgive in order to recover from trauma. What they do need to do is they do need to find a way to feel safe. That's the first step of trauma therapy. First, step one, to help the person feel safe in their everyday life, to help them feel safe in the therapy relationship. Step two, they need to be able to grieve the loss of the years that they invested in this relationship that turned out to be an enormous disappointment. Grieve the loss of the illusion of safety. Never again will this person believe that in all relationships with all people, they're going to be safe. No, sometimes they'll be safe, but sometimes they won't be. And they need to learn in trauma therapy how to be assertive and to say no, how to recognize a safe relationship versus an unsafe relationship, and how to grieve the loss of those years that they lost. And so there are some behavioral elements to trauma therapy, and there are some psychodynamic elements to trauma therapy. It needs to be integrative. And then they need to be able to find good relationships. That's the third part of trauma therapy. Good relationships where they trust people, where they feel loved, where they feel cared for. This can take a few years. And at the end of this process, will they forgive the perpetrator? Maybe, maybe not. Some people do. Some people say, I'm tired of being angry. I feel I've moved on in my life and I forgive this person. Okay. If they do, they do. And I can be curious about that. What does that mean to them? But if they don't, that's okay too. They can hold on to this idea that what happened to them was unfair, it was wrong.
Mhm.
They they continue to feel in part angry about what happened, but it doesn't hold them back. It doesn't make them feel bitter about life. They have a sense that they can move on. They have found new relationships. They've found ways to think of those lost years, to feel sad about those lost years, but to also not feel bitter about those lost years, and to
Yeah.
find a way of rebuilding their life so that they can have a good life now. Um, that's an okay place to be. And that can help them move forward so that they can be on track in their development. And they don't have to forgive. They
That's not
might
a
not.
goal. Yes.
It's
No.
not necessary. It's
Yes.
not necessary. And it's I tend to think of forgiveness as a process. If they forgive elements of what happened, well, I forgive him because he was in his 20s. Yes, he hit me, but he was, I think he's a better person now. I see he's remarried. He's I think a good man to his current wife. I don't know. And he said he was sorry. I feel like I can forgive him. That's a different story, someone who's like
Mm.
that. And that's fine. I don't force that on them. I'm curious about it, but it's not something that's required in trauma therapy. Some people, yes, some people, no.
So, which is most important is to rebuild the dignity of the client, right? And his values. So, this is the whole process, much more than
Abs-
forgiveness as a consequence, maybe.
Absolutely, yes. I think of the later stages of therapy as being, a process. I think that's well said. A process of rebuilding a sense of dignity for the person to feel that they are a a good person, that they're not a horrible person. You know, so often trauma survivors feel stupid and foolish and defective and incompetent. There's so many negative aspects to surviving trauma. Self blame is huge. So rebuilding a sense of dignity, rebuilding a sense of self determination, the idea that I can find a place for myself in this world. You know, yes, the world is a bit fucked up. Yes, it's not perfect. Um, and where is my place in this imperfect world? Oh, I can find a place for myself. Here's my place. That's a spot of self determination, and it's really important for trauma survivors to rebuild a sense of identity. Who am I? Not just a person who's a survivor of domestic violence. I'm so much more than that. Yes, I I am. I can be honest. I'm a survivor of someone survivor of domestic violence, or I'm a survivor of a war crime. I'm a survivor of these things, yes, but I'm not only that. I'm
Mm.
also other things. So what's my identity? Um, and then a sense of what are my values? What do I believe in? And am I starting to live in accordance with my values, or am I living in fear all the time? Am I living as a way of reacting to people, or can I build a sense of my own internal values? Uh, that's late in the therapy. These are all sort of later processes that happen long after a sense of safety. But I do find that those ideas, dignity, living in accordance with one's values, self-determination, those are ideas that help guide people toward post-traumatic growth, to be able to take what they've experienced and ask themselves, okay, what do I learn from this terrible experience that I would never wish on anybody? Um, and how do I build a life for myself? Um, what chapters do I want to build for myself?
Mm.
So that's the kind of growth oriented aspect of therapy. And as you can see, like I really do see myself very much as a psychodynamic therapist
Yes.
with trauma survivors, where yeah, it's kind of growth and development oriented. What's the person's ability to develop and grow, um, despite or sometimes as a result of, but sometimes despite their traumatic story. In other words, I see the trauma as a chapter in their life. I don't dismiss it. It's a very big chapter. It's not a small chapter in their life. In the story of their life, there are many chapters, and maybe chapter number 14 is a really big chapter, and it's a chapter that really affects all the other chapters. So it's not just one chapter, it's a chapter that has an impact on later chapters. And there will be later chapters. And the person now, at this point in their life, at age 45, is writing all the other chapters. And I can say to them, you have a lot of chapters ahead of you, hopefully. And you're the one who's going to write those chapters. And yes, they will all be influenced to some extent, maybe sometimes to a large extent, by that chapter 14, that chapter on the trauma that happened to you. And there will be some chapters that we don't know what they're going to look like. And we can be curious and wonder together, what are they going to look like? I don't know. It'll be really interesting to see how you write those chapters. It'll
And
be
how
up
do
to
you
you.
deal, for example, with people who have memory loss, split personalities, and they're here with you to build again their identity, to gain their identity back? It's really difficult. How do you deal with this kind of people?
Absolutely. So I will say that, so there you're talking about individuals definitely on the more severe end. Perhaps many of the examples I've used have been more mid-level
Mm.
trauma consequences, maybe people who have better ego functioning despite having a trauma history. I agree with you with clients who have uh, uh, different levels of dissociation. You definitely have a much bigger challenge ahead of you. And so I tend to work with different parts. Uh, I'm working right now with a woman who's almost completed with her therapy. We're about to have the final session in the next few months. We're just in the last final stages, and she definitely had dissociative disorder, and she had various younger parts that would continue to have an impact on her. I would get emails from her. She, I don't want to say her name, but let's just call her, I'm making this name up, Kelly. And so then she would have other parts. And so let's say I would get an email from Catherine, and then I would get a different email from Kellyanne, and a different email from Clarissa. And my client was Kelly, but she had these different parts, and these different parts would email me at different times. And one was a 14-year-old, one was a 6-year-old, one was, and so and this was okay. So this is going back about 7 years. I've worked with her. So clients who have dissociation, it is always long-term therapy. Not all my clients are long-term therapy. There are clients who I work much briefer, but for sure, someone who dissociates like that, it's long-term therapy. So I worked with her for about 7 years, and I would work with the different parts. And it would depend on who would come into the session. And sometimes I would hear her go into a little girl voice, and then all of a sudden I know that it's 7-year-old Kellyanne, let's say, and I would talk to 7-year-old Kellyanne as a 7-year-old, like the way I would talk to a 7-year-old. And sometimes Kellyanne would bring coloring pencils, and we would color together and talk as we were coloring together. We would do play therapy, like I was doing with a 7-year-old, and sometimes, and then Kellyanne, sometimes I'd have a 14-year-old who was very rebellious and very angry. This was a girl who, not a girl, I mean, when I saw this was a woman who was in her 30s, is in her 30s. And when she was a very young girl, she grew up in a religious cult, and her parents would physically abuse her physically, but her parents were loving when they weren't physically abusing her. So it was very confusing. And
Wow.
she does actually have stories of quite a bit of love from her parents, um, when they weren't physically abusive. When she would misbehave, they would engage in not just spanking, but actual physical abuse. No question about it. Everybody would agree this was quite severe physical abuse. This was very confusing for her, of course, as you can imagine. So feelings of love, but feelings of fear, but feeling like lots of different. So she would dissociate. She this it would it's split her personality. I worked with the different parts, until, as we worked together, sometimes these different parts would ask me questions, would, you know, a crisis emerged a few years ago when she wanted me to come to, I won't say the details, but wanted me to come to a particular event in her life that was, an important event in her life. Um, and I had to say to her, that I wouldn't be able to come to this event in her life, because of therapeutic boundaries. And this created a huge crisis, because this feeling of, well, wait a minute, my, it's like you're my father. And as my father, you're not willing to come. And of course, this required me working with all the different parts about what it means that I'm not her father. And I worked with her adult side about this, but I worked with younger parts as well. And this became a really healing moment, because it really brought in, throughout our work together, we use the therapeutic relationship. But this really became important, because with each part, we looked at the therapeutic relationship, and we grieved the loss of me as her father. So even with this 7-year old, we talked about how, she wished I was her father. And I said to her, it's I, as a 7-year old, I talked to a 7-year old, how of course you're mad that I'm not your daddy. And, it's not fair and it's upsetting. And like I would be very empathic as I would to a 7-year old. And of course with her other parts as well, we really worked on her feeling angry with me, her feeling of loss, her feeling that I was a disappointment, that I wasn't able to be the father she wanted me to be. Um, and I just worked with her on those feelings and reflected. And I mean, it's nothing super fancy. It was very much just very psychodynamic work where I took responsibility for that reality and worked with her around what it felt to her and really kind of unpacked all the different feelings and gave space for the different feelings. And as she felt me reflecting and giving space, she integrated. Um, she's not 100% integrated today, not 100%. There are times that different parts still, but she has tremendous awareness of her different
Mm,
parts. So her more adult self, her let's say, yeah, the more dominant adult self, let's say part self state, um, absolutely is aware that different sides of her are feeling different things. And she can say, my 7-year old is feeling this way, or she can kind of connect to these different parts of her. But, and they still do have an impact, but she's much less fragmented today than she was 7 years ago. And she's really made tremendous progress in her life. So it's slow, steady, patient, loving, boundaried, work with a good therapeutic frame, with using the relationship. Um, that's kind of that's the way I worked with her,
I can
and
imagine.
that's how I work with um, clients who dissociate.
Mm.
I
And
mean, it's not easy. And I'm giving you an example of a case that went well,
Mhm.
and there are examples of cases where it doesn't go so well. And I mean, and some of the challenges are like everybody experiences that some clients aren't ready to do the work, and some
Mm.
clients don't. Um, uh, you know, um, you know, but by and large, I do find with most of my clients, this approach tends to work well.
Mm. And do you think that for a therapist to understand trauma survivors, we have to had maybe some traumas in our life, or it is okay to have grown in a happy, healthy family? Do you think it's just about empathy or really being able to relate to someone's story?
Well, let's look at the research. Let's look at what research says. And I don't want to upset your listeners, but I will say
Be honest.
there are some realities here. It does work best if you're a therapist. It does work best if you have a secure attachment. Okay.
Mhm.
Now, does that mean that you must be someone who's never suffered anything or has grown up in a perfect home? No, it does not. I think it helps to have experienced some suffering in your life so that you can engage with the feeling in a way that's more direct. I think that that's helpful actually. So in my case, I'll be honest, I did experience some pretty severe bullying as a kid from other kids, not from my parents at all. But my parents, I talk about them in detail
Yes.
actually. Now, my parents were not perfect by any stretch, but I will say that in terms of risk factors for me personally, I grew up in a home where my parents were children during the Holocaust. So my mother is 80, let's see, she was born in 1937, 80. eight now. My mom's 88, going on 88. Um, my dad passed away a few years ago, so they were little kids. I'm Jewish. My parents were little children during the Holocaust, and my mom was 7, my dad was 10, and my dad's father was murdered. My mother, her parents were not killed, but my mother was separated at 7 from her parents for 9 months without any explanation given. So both my parents are absolutely trauma survivors. There's just, full on trauma survivors. They experienced attachment trauma in a very severe way. This impacted them and impacted their parenting and had an impact. I would say I do believe subjectively that I'm probably securely attached with a little bit of anxious attachment thrown in there, just a little bit, I think, but it's hard to diagnose yourself. Um, I've been in therapy, and I think that's the key, is that if you um, think that your work is being affected by your past, go into therapy. It's incredibly helpful. I was in therapy for 4 years as a graduate student when I was living in Michigan in my 20s. And it was unbelievably profound as an experience. I would say it's as important as all the training that I've had was going through good long-term therapy with a good therapist who challenged me, who was empathic, who worked with me. That's how I learned how to do therapy, from this really, really good therapist. That's what I would say is critical. So it's helpful to be securely attached, yes, but
Mhm.
I would say the more important thing is go for therapy, feel that you have someone you can talk to and that you're learning and that you're challenging yourself to be curious about yourself. Don't get a therapist who only just agrees with you. If your therapist is just saying, "Oh, I'm so sorry, that's so terrible," and all you do is complain in your sessions, that's not good therapy. Your therapist should challenge you. Your
Mhm.
therapist should push you to think about things in ways that are different, and sometimes your therapist should irritate you, and that's okay. Be open to being a little bit irritated. Your therapist should also understand you. Your
Mhm.
therapist should listen. Your therapist should be patient. Your therapist should be curious. Your therapist should be compassionate. All those things are really important, and your therapist should challenge you. All those things make for good therapy.
Yes, like a real dynamic relationship, a true one. Yes.
Exactly. And if you're feeling annoyed with your therapist and don't understand something, you should be able to say, "I don't understand why you said that to me. That really upset me." And your therapist should respond with, "Wow, that's really interesting. Let's be curious about why you were so upset." You know, if your therapist responds defensively, "Oh, I didn't do anything wrong," that's not great.
Mhm.
So find a good therapist who can be curious about those moments. But your therapist should also challenge you. They shouldn't say, "Oh, I'm so sorry for upsetting you." No, they might have been a good reason why they said what they said, and they should talk to you about that and challenge you as well. They should challenge themselves, but they should also challenge you. That's good therapy. That, I think, is key to us being good therapists. The other thing I would say that's really important um, is to have a good peer supervision.
Mhm.
So if you're a therapist and um, you've been through therapy, great, wonderful, that's good to know. But you're now doing difficult work with trauma survivors. Have a group of people who you work with who also do trauma work, and talk to them and talk about your cases and challenge each other, and make sure that you uh, ask people to challenge you in the work that you're doing. Make sure that it's a group of people who you trust and a group of people who you can be, um, that can be a supportive group, but
Mhm.
also a group that challenges each other. So those are things that I would recommend um, if you're doing trauma work. But yes, it's better to be securely attached. Of course it is. I mean,
True.
um, but we're not always lucky enough to be securely attached. So we have to work with what we have.
Mm. And Robert, my last question is what did you what do you like? What is your passion about these trauma survivors? Because you care about them, you care about their stories, you're passionate about that. What is the core? Is it your parents'
Oof.
story? Is it how did you?
I mean, I think, yeah, I mean, I think yeah, that's a good question. What is, I mean, I do, my rehearsed answer is that I do think I came to this because of my Jewish upbringing, where the Holocaust was such an important story in my family. Like, even though I didn't go through it myself, I would say that it figured in so many different things. I mean, it figured in the reason my dad really couldn't play with me. My dad, he couldn't be playful. He tried, but it would turn into a little lecture about, how you should do this or you should do that. He was a loving man. He was, but he was very, very limited by his history. And that affected me a lot. I mean, in the ways, the things that I read, when I think back on the books I read as a kid, they were all books about kids whose fathers were unavailable. I think back on children's books I read, movies that were my favorites. They were all on the same, it was the same theme that I was working through as a kid. I had no idea until I went into therapy. It was really in therapy that this became clear, and then it became even clearer in my 30s and 40s as I became a parent myself, and I realized I was doing so many things to try to be different than my dad, um, uh, and I think I think the issue is mostly worked through, but we never work through everything 100%. In my grandparenting now. So I'm now a grandparent, and my wife and I both find me to be a little less anxious, a little less trying to be perfect. I think I tried so hard with my kids. Luckily, I think my kids are okay. I think so. They would say they are. I don't know. I think they are.
You're humble. You're humble.
Hopefully. But I did feel anxious as a parent, and I think it had to do with this sort of trying so hard to be different, to fix the ills of the past, kind of thing. And I think I'm more relaxed now as a grandparent. But it's affected everything in my life. It really has affected, and it does affect me as in my work with my clients. So I think my personality is so impacted, um, uh, by indirectly by being a child of Holocaust survivors. Like it's had an impact, and so I think with my work, very often there is this desire to help people work through loss, and I think it's I mean, I think if I'm going to analyze it, yeah, I mean, there's a sort of fantasy of undoing the ills of the past, standing up to bullies, that sort of thing. It's part of my internal fantasy life. It's so I do think it affects me in a deep way.
Yes, by
I
helping
think that's where it comes from. I think so.
rebuilding their identity, to fill your void, their void, to
Yeah,
help them. I mean, it's all correlating. Yes.
yeah, I think so. Yeah,
So
I think that's an on. What's
you're
that?
passionate about your work, even though
Yeah,
today you're very still, a still man, you're very happy, you're
yeah.
still profoundly, uh,
Yeah,
yes.
yeah, yeah. I like it. I mean, I think people say to me, like, I had a patient the other day. So this person is a woman who's in her 30s, and she's autistic. I mean, she has a trauma history, but she's autistic. So she's emotionally, like, it's very limited what we could do together. And a lot of our work was very much, she's other also a mother. A lot of our work was very much about very behavioral advice giving, because I mean, she couldn't really do much deep emotional work. But towards the end of, like, so we had our final session, and I said to her, tell me a little bit about how you felt about therapy, and like, or I think, no, that's, I asked her about how would she know if she needed help again, and she said, well, I guess I would call you, but do you think you're going to be doing therapy in 10 years? And I said, well, I mean, I'm 61 now. I think I could. I mean, maybe not as many clients, but I think I will. And she said, well, why would you do that? And she said, you're a good therapist. Wouldn't you retire by then? And I said, well, I really enjoy it. So I think, at least to some extent, I think I would continue. And she goes, oh, God, you have the most boring job in the world. I don't know why anyone would continue doing that. Listening to people all day long. I couldn't think of anything more boring.
And for you, it's the most joyful moments.
I just I thought it was very cute, and anyway, it was cute.
Yes.
Yeah,
Well, I want to really to thank you for all your precious time that you gave me, because
sure.
this is a profound subject in my work, because I'm dealing also with women who have domestic violence and so many more traumas in my session. So your work really impacted my framework, I will say, in a more subtle rhythm and silent moment, but it really triggers me sometimes to how to handle that. So I wanted to share with, some people who might be interesting or maybe into that field of therapy, to know how to handle this kind of, yes, clients, because it's really, it's quite complex, but it's we grow so much from that.
We do.
So
Yeah, yeah,
it's
we do.
but it's important to enjoy, to continue to enjoy our work, to be passionate. That's why I wanted to ask you that question, but of course you are.
Thank you. No, I appreciate the question. I appreciate the opportunity to share.
Are you
Yeah, yeah.
coming soon to France? Maybe to get
No,
connect.
there's no current plans. I'm doing a workshop for PESI, PESI, but that's in English, and that'll be on June 20th of this year. And if you Google my name, you'll get to my professor, my full name. Google my full name, Robert T. Muller,
Yes.
and you get to my professor website. At the very bottom, under upcoming workshops, you'll see a link to that workshop. It's called PESI, PESI. It's on June 20th, and it's a live workshop. But and then there's another one that's up there online from a company called Nefesh, Nefesh. That's an online company, and I have a 2-day workshop on the therapeutic relationship, and that's also under upcoming workshops on my webpage. So you can get that one as well. So there are a few that you can feel free to take a look, but they're in English. They're not in French. And I'd be happy to come to France or to do a workshop that would be translated into French. I do speak French, but not well enough to do a workshop, and I'm not fluent. I'm just. I mean, I can order dinner in a restaurant, but I can't really speak French well.
Well, I will be really honored if you one day are coming here in Paris or in France, and of course we will keep in touch. But your work is
Okay.
really important for all of us, and so much. So yes, I'm quite optimistic that
Okay.
you're coming
Good. Good.
one day here.
Good. Okay,
I'm
good. I'd
really
be,
deeply grateful for having you and for this conversation, Robert.
oh,
This,
of course. You're very welcome. You're very, very welcome.
yes.
Thanks so much.
Thank you, Robert. Thank
You're
you.
welcome.
Just